Hi, I'm Meadow Schroeder. I'm an associate professor at Werklund School of Education. My specialization is in school and applied child psychology. I would say ADHD is characterized by two main characteristics. The first one is inattention. So folks who can't pay attention for long periods of time or tend to interrupt, not being able to focus. The second one is impulsivity and hyperactivity, and that's where kids can't stay still, they're running around, they would be impulsive in terms of doing things without thinking and acting. All kids, regardless of gender, would have similar symptoms. The impulsivity, the inattentiveness, the hyperactivity. Girls do tend to fall more on the inattentive spectrum, or their hyperactivity might be missed and not seen the same way as boys. So where boys might be really hyperactive and they might be running around in the classroom, girls might be just kind of sitting in their seat daydreaming. Or girls sometimes will try and cover up their hyperactivity and really work hard to not show it, but in reality, they actually have the same symptoms as boys do. There's actually many consequences for kids that go undiagnosed. The most obvious is academics. They can really struggle that way because maybe they're not doing their homework, or they're not getting their stuff done in class, or they're missing really key pieces of information. But when you're looking at kids getting older, kids can engage with more risky behaviors. So it's really important that if a child does have ADHD, there's some really early intervention where they're getting some really good life skills and strategies that can help them be successful all the way into adulthood. Medication is not a panacea. It's not going to be the answer that parents want. It's not going to fix their kids' ADHD completely. Research says that the best way to intervene is through some behavior strategies, understanding how you learn the best, how you function the best, and then the medication can help you learn those strategies easier. So within Alberta, to give a diagnosis of ADHD, there's two main ways that you can go about it. So you can go to your family doctor. Some family doctors feel like they have the training and competency to provide that diagnosis. If they don't, then they can get a referral to a pediatrician. And most pediatricians have some really good training around diagnosing ADHD and prescribing the medication. If parents don't want to go that route, they can just go through a school psychologist or a clinical psychologist, but the school psychologist or clinical psychologist can't prescribe medication. So with my research right now, I'm trying to take a traditional online module that supports students with ADHD to transition into post-secondary. And I want to take that module and I want to gamify it. Kids would go through a virtual high school and they would talk to different people about ADHD, understand how ADHD affects them, and then talk about post-secondary. There's also going to be information about advocacy and knowing when you have to get some help, but also what kind of resources post-secondary provides for them. Things like accommodations, and also how to talk to professors about your disability and how to make sure that you're getting your learning needs met in the classroom. I'm hoping that we can track some kids long-term to find out, did having this information beforehand really help them be better prepared? The first year of post-secondary is really key for kids. That's when you see the most kids dropping out or not doing well. So if we can get them through the first year and hopefully into graduation, then they're going to set them up then for success in the future employment.